What if I told you that one of the biggest revolutions in African healthcare didn't happen in oil-rich Nigeria or donor-favored Ghana, but in a landlocked country often ignored by the headlines, Burkina Faso? You'd probably say, impossible. And yet, here we are. In a world consumed by stories of instability and poverty, three West African nations, Burkina Faso, Mali, and Niger, flipping the script. Leading that charge is a young, defiant reformer, President Ibrahim, and he's not just talking change, he's building it. Bill Gates took notice. The world should too. They called it an old baby, the emergency medical service known as SAMO. For nearly 30 years, it existed only in vision, a promise collecting dust. But now, it's real, operational, and saving lives. At the heart of this transformation lies one fundamental belief. Healthcare is not a luxury. It's a sovereign right. Burkina Faso, under President's leadership, launched a comprehensive overhaul of its health system. Not with foreign blueprints, but with homegrown determination. In an official ceremony at the Martyrs Monument in Ouagadougou, the government unveiled a fleet of mobile clinics, 36 medical vehicles, 13 refrigerated trucks, 12 wagons, and 11 pickups. This wasn't optics, it was action. Bill Gates, a man known for his meticulous praise, spotlighted Burkina Faso, Mali and Niger, stating they are showing the world what's possible. Infant mortality? Down. Vaccine uptake? Up. Emergency care? Immediate. These nations aren't rich in oil, but they're overflowing with resolve. President Ibrahim didn't inherit a well-oiled machine. He found a health system fractured by foreign dependency, abandoned clinics, and bureaucratic red tape. But he didn't complain. He reimagined everything. First, he nationalized key components of the health sector, reducing reliance on NGOs with external agendas. He then invested in the people, funding local doctor training, digitizing rural vaccination records, and deploying emergency services in regions plagued by conflict. Burkina Faso became a land where mobile clinics reached dusty villages and solar-powered. Refrigerators store vaccines and midwife stations. Forget air-conditioned offices in the capital, went grassroots. In the remote village of Zener, a local midwife named Awa now delivers babies in a clinic equipped with clean water, emergency phone lines, and refrigerated vaccines. This is not a pilot project. It's the new standard. Gates praised the approach. Decentralization, local leadership, and African-engineered technology. Not imported models, but tailor-made solutions. Health policy in Africa has often meant waiting for donor aid, not under. He reallocated military funds into healthcare, a bold move. Critics called reckless. They were wrong. Today, trauma centers operate where only military checkpoints once stood. These hybrid facilities combine security and care, safeguarding both bodies and trust in government. In contrast, Nigeria, with far greater wealth, still struggles with basic maternal care. Proved that leadership, not resources, dictates results. When COVID-19 hit, most nations scrambled. Burkina Faso mobilized, invested in vaccine education, cold chain logistics, and local partnerships. So by the time global supplies arrived, Burkina Faso was ready. Result: high rural vaccine uptake, low pandemic mortality, and most crucially, rising public trust. Then came the next phase. Domestic vaccine packaging in collaboration with West African biotech firms. Something even some Western nations hadn't attempted. This wasn't just pandemic response. It was long-term preparation for malaria, polio, and cholera. One of the most powerful shifts under administration? Women and youth are no longer sidelines, they're leaders. From midwives in rural clinics to youth-run AI diagnostic startups, the engine of healthcare is young and female. New laws mandate gender parity in public health leadership. Scholarships fund thousands of women in nursing, public health, and epidemiology. In Bobo Dioulasso, students are building diagnostic tools in local dialects. Aids highlighted the Youth Innovation Fund, over 200 startups launched, all under 30s. While Nigeria battles youth unemployment, Burkina Faso nurtures the next generation of healers. Nigeria accounts for 28.7% of global maternal deaths. That's nearly 1,000 mothers lost per 100,000 births. Why? Not lack of resources. Lack of will. Nigeria's health budget. 4%, Burkina Faso's nearly 9%. While Lagos hospitals overflow, Ouagadougou's trauma centers operate smoothly. While Nigeria's rural clinics struggle for electricity, Burkina Faso powers its health system with solar grids. The message from Gates was loud. If Burkina Faso can do it, what's stopping Nigeria? This isn't just a health success story. It's a governance revolution. Didn't just fix a broken system. He redefined what public service means. He listened to his people, acted with urgency, and treated health not as an expense, but an investment. In doing so, he created a blueprint for other African nations. Decentralize, localize, empower, and lead. Burkina Faso, Mali, Niger. Nations once overlooked are now leading the charge. Not because they're rich, not because they're perfect, but because they dared. President Ibrahim stands as a symbol of what's possible when leadership is bold, grounded, and relentless. So here is the question every African leader must answer. Are you going to keep outsourcing your policies? Or will you start listening to your people, investing in your youth, and building systems that last? Because the future of Africa is not being written in boardrooms abroad. It's being forged in the clinics of Zener, the trauma centers of Ouagadougou, the mobile fleets rolling across the Sahel. Nigeria, the ball is in your court. Like, comment, subscribe. Not just to this video, but to the idea that transformation is possible, and it's already happening. Africa, are you ready to rise?